Sanders.
Thank you. Let me ask Dr. Verma. Simple question. Who do you think is best prepared to determine whether Mifepristone is safe and effective? Do you think it is members of a state legislature? Do you think it is United States senators? Or do you think it should be organizations like the American Medical Association, the American College of Obstetricians and Gynecologists, and doctors and scientists who for decades have studied the issue?
Thank you for the question. As a doctor, I know that people are capable of making these decisions for themselves. They are the experts on their own lives and can make these decisions guided by evidence, science, and what's happening in their own lives.
Let me ask you another question. I was interested in what the Attorney General said. Very simple question. We live in a society where everybody here talks about freedom, right? We all believe in freedom. Who should make the decision regarding her own body? Should it be a woman? Should it be the United States Senate, governors, attorney generals? Who should make that decision?
People should be able to make decisions for themselves, guided by their supported by their families, guided by evidence and science. And I do want to highlight again some misinformation that we've been hearing around the source of some of the harm that we're seeing right now. A lot of the cases that we're hearing about are a direct result of abortion bans and restrictions. People are desperate because they cannot get the care that they need in their communities with their trusted clinicians and people in their communities in the way that they need. And that is why we are seeing these cases come up. It is a direct result of abortion bans and restrictions. Access makes people safer.
Dr. Verma, can you speak for a moment about what happens when states limit access to Mifepristone? Can you talk about what it means in a state like Louisiana and many others if women, for whatever reason, want to terminate a pregnancy and have no other options?
Absolutely. Limiting access to Mifepristone, misoprostol, medications that we know are safe and effective takes important evidence-based treatments away from people. And we're seeing, you mentioned Louisiana, we're seeing Louisiana has now made these medications controlled substances. And we're seeing the dramatic impact that that's having on people that need abortion care, that are experiencing miscarriages, and people that are, for example, having postpartum hemorrhages. I've heard from my colleagues in the state and heard from, for example, the Department of Public Health in New Orleans has said this is very much harming people in the state. So for example, when you have a patient that's having a postpartum hemorrhage, I've been in many of these situations as a doctor that provides care on labor and delivery. I need access to those medications right away. That is a life-threatening emergency. It's one of the leading causes of maternal mortality. I need to be able to access safe medications right away to save that patient's life. And so we're seeing the impact of these restrictions and things limiting access to Mifepristone and misoprostol, not just on patients who need abortion care, but a whole range of care that is life-saving for them.
If I could ask the Attorney General Myrtle a brief question. If I understood you correctly, you said that over 900 women a month are turning to Mifepristone. Was I correct in hearing that?
Yes,
in Louisiana?
those are statistics from a pro-abortion advocacy group.
But you kind of indicated you think that might be in the ballpark.
It's the only data that we have.
All right. If a woman in Louisiana turns to Mifepristone because she has no other option or that's the choice, that's 10,000 women a year in Louisiana. What do you tell those women who, for whatever reason, you may agree with it, I may agree with it, we may not, make a decision that for their lives they want to terminate a pregnancy? What do you say to 10,000 women in Louisiana a year? Do you think they have the right to make that choice, or do they not?
Senator Sanders, the policy decision of the overwhelmingly bipartisan legislature in Louisiana has enacted laws to protect the women of Louisiana. And I think that, you know, the issue here that you and maybe other people don't want to talk about is that we live in a land of the rule of law, and that is the law of Louisiana, and so they can seek that care in another state.
Sorry to terminate, to cut you short here, but I just have a few seconds. In other words, essentially what you're saying, 10,000 women a year in Louisiana make a decision, and that decision is overridden by the state legislature rather than their own choice. I think that's unfortunate.
Senator Sanders, you know, I would also continue to say that it is illegal, it is unethical, and it is immoral for anyone to send pills to someone with no medical supervision and then tell them to lie at the
Yeah,
hospital.
but that happens because of the laws of your state.
No, it happens because people from outside our state are sending them into our state to nullify our state laws. That's why it happens.
OBGYN Dr. Roger Marshall.
Thank you, Chairman. Good morning, everybody, to our witnesses. Dr. Verma, do you know